From the JAMA Network, this is JAMA Clinical Reviews, interviews and ideas about innovations in medicine, science, and clinical practice. Here's your host.
Hello, and welcome to this JAMA podcast. I am Mary McDermott, Deputy Editor of JAMA, and I am here today with Dr. Smita Bhatia, who is Director for the Institute for Cancer Outcomes and Survivorship at the University of Alabama at Birmingham School of Medicine. Today, we will be discussing Dr. Bhatia's narrative review entitled Clinical Care for People Who Survive Childhood Cancer. Welcome, Dr. Bhatia.
Thank you.
And I just wanted to mention that in addition to directing the Institute for Cancer Outcomes and Survivorship, that you are also a practicing clinician. Is that correct?
Absolutely. I do see children with cancer. Yes, I do.
And we're here today to discuss your narrative review entitled Clinical Care for People Who Survive Childhood Cancer. Can we start by having you tell us approximately how many adults in the United States have survived childhood cancer and why it's important to know whether a patient has survived a childhood cancer?
Thank you for that question. Let me just begin with the number of children who are diagnosed with cancer. So within the United States, about 15,000 children between the ages of 0 and 19 are diagnosed with cancer, and about 85% of these children survive 5 or more years. So this then results in a growing population of childhood cancer survivors, such that currently there are over 500,000 people who have survived childhood cancer in the United States.
And what are some of the more significant chronic health problems that adults who survived childhood cancer encounter?
Right. So if you were to actually catalog all the chronic health conditions that people who have survived childhood cancer were to be included, one would find that over 95% of them have significant health-related problems by the time they are 45 years of age. The most common health problems include endocrine problems, such as growth hormone deficiency and hypothyroidism, subsequent neoplasms or second and third new cancers, and then cardiovascular diseases such as coronary artery disease and congestive heart failure.
Can you talk a little bit about then how history of cancer as a child affects future life expectancy?
Because of these chronic health conditions that children who've survived childhood cancer encounter, they are at risk for premature death. And this presents itself as a shortened life expectancy. For example, people who've survived childhood cancer who were diagnosed in the 1990s have their lifespan shortened by approximately 9 years.
And has that improved over time?
And that has. Unfortunately, data are limited in terms of the large cohorts that have been followed. They've been diagnosed only up to 2000. There are newer efforts that are currently underway where we are taking children who have survived cancer through the early 2000s, 2010, 2020. However, if we were to look at people who've survived cancer diagnosed in the 70s, through the 80s, and then through the 90s, we see that there has been a significant improvement in the lifespan and life expectancy for these individuals.
And what clinical history related to the childhood cancer should clinicians ask about when they are caring for a patient who survived childhood cancer?
What we recommend is that if a generalist sees an individual who survived childhood cancer, that they ask for the type of cancer that the individual had, since it's not a single cancer, right? It's multiple varieties of cancers that these children are diagnosed with. So the type of cancer, the age at which the cancer was diagnosed, and then if they can get information on the types of treatments they received. For example, if they can get information on the radiation, whether the child had received radiation or not, and if possible, the field of radiation, right? So was it to the brain, to the chest, to the abdomen, to the extremities, and then doses of certain types of chemotherapy, such as alkylating agents and anthracyclines. These, we believe, are enough information that could help the generalist to then go forward in developing a plan of surveillance and health promotion and early detection of the long-term complications.
And can you talk a little bit more, for example, about radiation-related adverse effects that can affect adults who survive childhood cancer?
Radiation can cause a variety of complications. The main things to remember about radiation and its long-term effects in children with cancer is that those effects are limited to organs within the radiation field usually, and they are more likely to occur if the radiation were to be given at a younger age. So I'll give you a few examples. For example, radiation to the brain is associated with a higher risk of cognitive problems and new brain tumors and meningiomas. Radiation to the neck can result in hypothyroidism and thyroid cancer. Radiation to the chest in young patients can result in the development of breast cancer and also lung cancer. And then radiation to the abdomen can result in not only diabetes, but also a higher risk of colorectal cancer.
And can you talk about basal cell carcinoma and its relationship to radiation?
Basal cell carcinoma is the most common side effect of radiation. It occurs in a large proportion of patients who received radiation. 90% of those basal cell carcinomas develop within the radiation field. Again, there's a linear dose-response relationship such that the higher the dose of radiation, the greater the risk of basal cell carcinoma. And then finally, about 46% of individuals who've developed basal cell carcinoma, the first one due to the radiation, are at a higher risk of having multiple basal cell carcinomas.
And then what about chemotherapeutic agents? You referred earlier to alkylating agents, that they can cause later problems in adulthood. Can you speak to a couple of agents that are particularly associated with adverse health effects in adults and what those adverse effects are?
There are two classes of chemotherapeutic agents which are used in about 55 to 60% of childhood cancers. And these include anthracycline class of chemotherapies and the alkylating agent class of chemotherapies. Both of them are associated with unique and distinct long-term complications. The other thing to remember is that the effects of chemotherapy are observed in multiple organ systems, unlike radiation, where most of the late effects were limited to the radiation field. So, for example, anthracyclines are associated with an increased risk of cardiomyopathy and heart failure. And this, again, there's a dose-response relationship such that children who receive 250 milligrams per meter squared or greater of their body surface area of anthracyclines are at a much higher risk of developing heart failure. Alkylating agents are typically associated with gonadal dysfunction, ovarian insufficiency, and then infertility. Alkylating agents have sometimes also been implicated in the development of breast cancer and colorectal cancer.
And are there certain cancers in adulthood that are particularly common in people who survive childhood cancer? You alluded to some of this earlier.
Right. So there are several cancers which develop as what we call subsequent neoplasms, right? Because the first cancer is the childhood cancer, and these are new cancers that are developing. And they, because of the treatment that was given to treat the primary childhood cancer are developing in the adults who've survived that childhood cancer. And this adult person who survived childhood cancer is at a much higher risk of developing that complication or second cancer as compared to the general population. So I'll give you some examples here. For example, young girls around the age of puberty, 13 to 15 to 16-year-olds who were treated with chest radiation for their Hodgkin lymphoma, for example, subsequently develop breast cancer. This breast cancer develops at a younger age than in the general population, and the risk is higher as compared to the general population. And after developing the breast cancer, the mortality rates are higher in these individuals who developed the second breast cancer as compared to those who had a de novo breast cancer. Similar examples are there for radiation-related brain tumors, radiation-related colorectal carcinoma, or sarcomas.
And how about the risk of developing cardiovascular disease as an adult? Is that primarily related to radiation and also the anthracycline type of chemotherapy, or are there other considerations?
Right. The types of cardiovascular disease that have been observed in individuals who survived childhood cancer include cardiomyopathy and heart failure, coronary artery disease, pericardial disease, and then valvular disease. And then, of course, if we want to include stroke as a cerebrovascular event in this particular group of diagnoses. Most of these complications are related to anthracyclines and or radiation. So, for example, I've mentioned about the association between anthracyclines and heart failure. The higher the dose, the more the risk. But then the compounding factor here is the presence of cardiovascular risk factors, such as diabetes mellitus, such as hypertension, such as dyslipidemia, which when combined with high-dose anthracyclines significantly increase the risk of heart failure. Coronary artery disease is usually the result of chest radiation, where the heart is in the field of the radiation. And then, of course, the risk increases tremendously if hypertension were to be present, in addition to the chest radiation for these individuals.
Is there any evidence that treatment for childhood cancer increases the incidence of hypertension or hyperlipidemia?
Yes, there is actually. Studies have been done where they have compared the prevalence of hypertension, dyslipidemia, and diabetes in childhood cancer survivors and compared them to the general population and found at least a 2 to 3-fold higher prevalence of these cardiovascular risk factors in our childhood cancer population than in the general population.
And so, given all of this, how do you go about monitoring adults who survive childhood cancer for these diseases?
So, for people who have survived childhood cancer, what we would like to do is to recommend that they receive lifelong care. And this care should focus on health promotion and early detection of these potential complications that we discussed that have resulted from their cancer treatment. And we have recommendations in the form of guidelines. There are national recommendations from the Children's Oncology Group, as well as international recommendations from the International Guideline Harmonization Group that recommend screening for patients who've survived childhood cancer. And these recommendations anchor on the fact that a patient knows and the healthcare provider knows exactly what treatments the children have received as they come into their adulthood. However, for people who don't have those histories of the types of treatments that they've received, we have some general idea by the diagnosis and by the era in which they were diagnosed and the age at which they were diagnosed, where we can develop some kind of recommendations to give to the generalist or the healthcare provider who's seeing such adults who survived childhood cancer.
Thank you for this really informative and helpful information, Dr. Bhatia. Is there anything else that you would like to add?
What I would like to say is that there is still miles to go in terms of improving the health of our childhood cancer survivors. Now, we know that from our previous research that we can and we have reduced the doses of treatments, both radiation and chemotherapy, and those have resulted in lower risk of developing these long-term complications. But there are certain subgroups of childhood cancer that continue to require higher doses of these chemotherapeutic agents and radiation. And for those particular groups of individuals who've survived childhood cancer, there is a need to develop rigorous trials in order to understand how we can mitigate these long-term complications, improve their quality and quantity of survival. Thank you.
Thank you so much, Dr. Bhatia, for this really wonderful overview of the care of patients who survive childhood cancer. Thanks for listening. This is Mary McDermott, Deputy Editor of JAMA. For more of our podcasts, please visit us at jamanetworkaudio.com. You can subscribe and listen wherever you get your podcasts. This episode was produced by Shelley Steffens and Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.